One of the biggest fears that many folks have, especially as we age, is losing our sight, losing our vision. And we have a guest today from Kaiser Permanente who is in their ophthalmology department. Dr. Keith Pince joins us today. Doctor, welcome to the show.
It's good to be here. Thank you.
A little bit about your background, where you studied and got your training.
Well, I sort of took a circuitous course. I was originally a chemist, did some chemistry, and then became a pharmacist. Then went to medical school at USC, did my residency at USC, and then I did a fellowship in retina diseases in Los Angeles. Mm-hmm. And I'm currently a retina specialist at Kaiser Permanente in Orange County.
All right. Well, you've had an interesting background. You understand the chemistry of the drugs you prescribe.
I do, yes.
Maybe better than some of your peers at this particular point. We're talking today about something called macular degeneration. I know we have, unfortunately, cases of that right here in this community. Many people we know have family members or friends who say, oh, so-and-so's got that going on in their eyes. To kind of demystify it, maybe you can give us kind of a lay definition of what that is, or at least in terms we'll all understand.
Well, the macula is a part of the retina, which is the basically the film in a camera. If you think of the eye as a camera, the retina is the film in the back of the eye. And the macula is the central portion of that film that gives us our fine vision, the ability to see details, ability to see read, to recognize faces. And over time, with age, that can degenerate, resulting in a loss of central vision and significant disability for our patients.
Mm-hmm. Do we know what causes it?
It's a multifactorial disease, and we don't have a complete handle on what the exact causes are. The most significant risk factor, of course, is age. Mm. So with the passage of time and the fact that the retina is a highly metabolic tissue and active, it sort of starts to wear out over time. Mm-hmm. Mm-hmm. There are specific risk factors associated with it. Some people think exposure to sunlight over a lifetime. Caucasian people are at higher risk for development of macular degeneration. Obesity has been associated with it, smoking, and there is some associated with hypertension as well. So
there's some things we can do.
There are some things
help mitigate it. Wear good sunglasses, control our weight, get the high blood pressure under control. Picking our race is something we don't have much choice about. Our parents made that decision for us. So at least there's a few things we can do to help. Symptoms, what should we look for to indicate that we might need to get this looked at?
Well, obviously as we age, our vision will start to diminish for a variety of reasons. Cataracts, just the normal loss of nerves in the retina will lead to a diminishment in acuity. But the most common finding is blurred vision in the center of the vision. And one of the hallmarks that we look for is a change in the perception of straight lines. Mm-hmm. So if you were to look at a grid on a piece of paper, you might see that the lines are bending, mm-hmm. and that would be a good indicator that something is going on.
So you're looking at a piece of graph paper, for example.
Exactly.
And the lines aren't perfectly straight. They start to squiggle. Exactly.
And those types of, we call that an Amsler grid after the person who sort of popularized that mm-hmm. Screening device. They're available in your doctor's offices mm-hmm.
Right.
for you to use on a routine basis.
Obviously, if somebody's seeing an ophthalmologist on a regular basis, which everybody over 40 probably should, that's one of the things you check for.
That's correct.
Right. All right. Treatment. What's available?
Well, let's go over first. What can we do to try and prevent this?
Okay.
There are two basic types of macular degeneration: the dry type and the wet type. The dry type is much more common, but unfortunately we don't have good treatments for that. But we do have some preventative measures you can use to help diminish your risk. Mm-hmm. And the mainstay of that is vitamin treatment. We have evidence from large studies in the country that use of antioxidant vitamins can help prevent severe visual loss from dry macular degeneration, or prevent the progression to severe visual loss. And there are multiple formulations available on the market. You can ask your pharmacist or your eye doctor.
Would just an over-the-counter multivitamin that says contains antioxidants, would that be good for
Not really. The doses of the vitamins tend to be a little bit higher and require probably a specific formulation for
so it'd be a prescription?
No, not a prescription.
Not a prescription, but a specific brand or a specific type?
Right, that's right.
Right.
Some of the names are Ocuvite, Preservision, Eye Caps. We have a generic brand that we have.
So you wouldn't need a prescription as such, but you'd need to know where to shop and where to get it.
Yeah, and the pharmacies will generally know which brands to offer.
Okay, back to your pharmacy training.
Yes.
You would know, of course, all about that as well.
That's correct.
Nutrition. You are what you eat. Are your eyes what you eat too?
Well, we have found over the years that there is a suggestion that diet can play a role in prevention. It's notoriously difficult to study dietary factors in disease processes. However, we do believe that a diet rich in green leafy vegetables that may supply antioxidants or the pigments in the retina itself that can have a protective effect is beneficial for patients.
Popeye and his spinach wasn't far off.
That's right, that's right.
Right. As far as treatment following diagnosis, a lot of folks really feel that's the end of it for them. They're not going to be able to see, not going to be able to drive. With some treatments, you can slow the process down.
That is exactly right.
It's not reversible at this point, though.
Some of the treatments that we're available to offer now can improve the vision. Does not reverse the process, though. The process is present and it's not reversible, but we can slow it down and even improve the visual acuity to the point where the patient is functional again.
Good.
The mainstay of the treatment for, and this is for wet macular degeneration, is injections into the eye of what we call anti-vascular endothelial growth factor compounds that inhibit the growth of these new blood vessels that cause the wet macular degeneration. So often requires monthly injections into the eye. It sounds worse than it actually is, but it's worth it to undergo a little bit of discomfort for the benefit of the medication.
All right. If you have concerns about your vision, you want to see your ophthalmologist, and remind you, as we do each week, remind you folks that if you're interested in finding out about the good programs that Kaiser has and some of the fine doctors they have, you can give their Orange County number a call. That's 932-2052, right here in Orange County, and of course that new facility just up the street from us in nearby Irvine. Dr. Pince, thank you for joining us today.
My pleasure.
Good to have you on the program today.
Okay.
Dr. Keith Pince, ophthalmologist there with Kaiser Permanente, and again, some good information on all of us having good vision. We'll be back with more on our program today after this brief timeout.